Hi, everyone, and welcome back to Chasing Care, where we help you navigate the often overwhelming world of adult care. I'm your host, Gavin Chase, and today we're breaking down the latest report from the Care Quality Commission, or CQC, which examines the state of healthcare and adult social care in the UK for 2023-2024. If you're searching for care for a loved one, waiting for an assessment, or unsure about choosing between a care home, live-in care, or home care, stay tuned because we're here to make sense of what the report means for you. So let's start off with an overview of the CQC report. The CQC annual report functions as a health check for the entire adult social care sector, and this year's findings are particularly eye-opening. According to the report, there's a troubling gap between the high demand for social care and the available resources. For example, over 2 million people in the UK rely on some form of social care, but due to staffing shortages and funding limitations, demand is outpacing supply. In this care conversation today, we're going to focus exclusively on the social care aspect. In fact, data from the report shows that 27% of people could not access the care they needed due to staff shortages. These shortages don't just impact new patients, they affect the quality and availability of ongoing care as well. For families, this can mean delays in getting essential services, especially for those who need post-hospitalisation support. So my key insight today is the strain on social care is not just an inconvenience. It directly affects health outcomes, as people are often waiting in unsafe conditions without the support they urgently need. Let's quickly take a look at bed blocking and delays in care transactions. One of the most pressing issues highlighted in the report is what is known as bed blocking or delayed hospital discharges due to a lack of social care availability. This occurs when a person medically fit for discharge can't leave the hospital because they have no adequate home support or care home bed available. According to the CQC, waits for care home placements or home-based care were responsible for 45% of delays for people waiting 14 days or longer to leave the hospital. To put this into perspective, nearly 4,000 people per day experienced these delays. This is a critical issue. It not only affects those who are stuck waiting, but also contributes to bed shortages across hospitals, impacting new patients who need acute care. For families, these delays add stress, especially if they're left to coordinate interim care or worried about their loved one's safety while they wait. So what action can we take? If your loved one is facing a delayed discharge, talk to both the hospital and social services early on. Ask about interim care options and if any temporary support could be made available. Bed blocking, for sure, can be frustrating, But staying proactive in communicating with both hospital and social care teams can definitely help. Don't take no for an answer. Now let's turn our thoughts to the types of care and about choosing the right option. If you've got past an assessment phase, choosing the right type of care is a critical decision. This year's CQC report highlights 3 main options: home care, live-in care, and residential care homes. But even here, there's a challenge. For example, home care services, which allow people to remain in their homes, have become strained due to staff shortages and funding limitations. The report found that 31% of home care providers had to turn away new clients this past year, making it even harder for families to rely on this option. Live-in care is another option where a caregiver resides in the home. It's more personalised, but it's not always covered by council funds. And lastly, there's care homes. But nearly 18% of these facilities received a rating of inadequate or requires improvement by the CQC in the past year, underscoring the importance of doing thorough research. So what should you consider? When evaluating these options, review the CQC ratings and talk with providers about staffing stability. Consistency and experienced care teams can be another good indicator of the quality of care your loved one may receive. And note, if you are unsure about the right option, speaking to a quality care advisor can be invaluable. This can clarify funding details, help compare care types, and support you in making the best decision for your loved one. Let's turn to the question of staff shortages and care quality. Now, staffing shortages have a substantial impact on care across the board. The CQC reports that social care sector has a vacancy rate of 11%, with about 165,000 care roles unfilled. This means that there are fewer caregivers available, often resulting in shorter visits, inconsistent care, leaving families concerned about their loved ones' needs are being fully met. The strain on caregivers also leads to higher turnover rates, meaning the continuity of care can be affected. So here's a tip for families. If possible, ask care providers about their staff turnover and training programs. It's essential to know who will be working with your loved ones and how prepared and experienced they are. Now we need to turn to the financial burden of care. Cost is another hurdle in the current care landscape. According to the CQC report, weekly care home placements can range between £600 and £1,600, while hourly home care costs have increased to between £20 and £30. These rates put a significant strain on families, many of whom are now considering financial aid options like direct payments, NHS Continuing Healthcare, and attendance allowances to cover some of these costs. While some of these funding sources can help, they don't often cover anything like the amount of care you require. So it's important to understand exactly what's available and what eligibility criteria are in place. So what proactive step can families take? By looking into your funding options early, often families find that they can qualify for some form of additional assistance that can substantially reduce their expenses. How do you make informed decisions for 2024 and onwards? Let's wrap up by looking at how to make informed decisions in the current climate. It comes down to being proactive, knowledgeable, and supported. You should use the CQC ratings and reports as a guide, but remember that every family's needs are unique. Whether you are considering home care, live-in care, or a care home, take time to research and visit facilities if at all possible. And most importantly, don't hesitate to seek professional advice from a quality care advisor who can help you navigate funding options, assess different care choices, and find the best fit for your situation. Thank you for turning to Chasing Care. If you want more information on this year's CQC report or to learn about care funding options, check out the links in our show notes. And remember, we're here to help you navigate the complexities of adult care. Don't forget to subscribe and share this episode with anyone who might benefit from this information. So until next time, I'm Gavin Chase, the host of Chasing Care podcast, and we'll keep chasing the best care options for you and your family. Till the next time, have a great day.